Remember, home health aides must never abuse patients in any way. They must also try to protect their patients from others who abuse them. If you ever see or suspect that another caregiver or a family member is abusing a patient, you must report this immediately to your supervisor and the agency. Reporting abuse or suspected abuse is not an option, it is the law. No. Define the following terms. Neglect. Harming a person physically, mentally or emotionally by failing to provide needed care. Active neglect. Purposely harming a person by failing to provide needed care. Passive neglect. Unintentionally harming a person physically, mentally or emotionally by failing to provide needed care. Negligence. Actions, or the failure to act or provide the proper care for a patient, resulting in unintended injury. Define the following terms. Malpractice. Professional misconduct that results in injury to a person through negligence, carelessness or lack of skill. Abuse. Purposefully mistreating and causing physical, mental or emotional pain or injury to someone. Physical abuse. Intentional or unintentional treatment that causes harm to a person's body. Psychological abuse. Emotional harm caused by threatening, scaring, humiliating, intimidating, isolating or insulting a person, or treating him or her as a child. Define the following terms. Verbal abuse. The use of spoken or written words, pictures or gestures that threaten, embarrass or insult a person. Assault. Or threat to harm a person, resulting in the person feeling fearful that he or she will be harmed. Battery. The intentional touching of a person without his or her consent. Sexual abuse. The forcing of a person to perform or participate in sexual acts against his or her will. This includes unwanted touching, exposing oneself to a person, or sharing pornographic material. As a home health aide, you are in an excellent position to observe and report abuse or neglect. Home health aides have an ethical and legal responsibility to observe for signs of abuse and report suspected cases to the supervisor and the agency. Home health aides are considered mandated reporters. Mandated reporters are people who are required to report suspected or observed abuse or neglect, because they have regular contact with vulnerable populations, such as the elderly. If abuse is suspected or observed, the home health aide must report to the supervisor immediately. Giving as much information as possible is important. This is a serious responsibility, and home health aides can help end this disturbing trend. Remember, who is vulnerable to abuse or neglect? Who is vulnerable to abuse or neglect? Some people are more vulnerable to adult abuse or neglect than others. They include the following: the elderly, the physically ill or disabled, the developmentally disabled, the mentally ill or disabled, people with communication problems, such as hearing, speech and vision impairments. All these people have a few things in common that make them so vulnerable. They are often unable to stand up for themselves and to report abuse or neglect to others. They may not even understand that they have rights to do so. Often these people can be much more demanding to care for, which increases their caregivers' stress. Their caregivers may not have been properly trained to care for these particular people, and they may not understand why these people behave the way they do. Caregivers may also be overworked, tired, stressed and unappreciated, on top of caring for someone who requires so much time and energy. These are the people who most need your help and protection from harm. They may not be able to speak for themselves, but the signs of abuse or neglect may speak for them, if you just know how to recognize these signs. Suspicious injuries. The following are considered suspicious injuries and must be reported. poisoning or traumatic injury. Teeth marks, belt buckle or strap marks, bruises, contusions or welts, scars, fractures, dislocation, burns of unusual shape and or in unusual locations, Chigarita burns, scalding burns, scratches and puncture wounds, scalp tenderness and patches of missing hair, swelling in the face, broken teeth, nasal discharge, bruises, bleeding or discharge from the vaginal area. Signs of abuse. Signs that could indicate abuse include as follows: yelling obscenities, fear, apprehension, fear of being alone, poor self-control, constant pain, threatening to hurt others, withdrawal or apathy, alcohol or drug abuse, agitation or anxiety, signs of stress, low self-esteem, mood changes, confusion, disorientation. Private conversations are not allowed, or the family member caregiver is present during all conversations. Reports of questionable care by the patient and his or her family. Signs of neglect. Signs that could indicate neglect include as follows: pressure injuries, bed sores, unclean body, body lice, soiled bedding or incontinence briefs not being changed, poorly fitting clothing, unmet needs relating to hearing aids, eyeglasses, etc., weight loss, poor appetite, uneaten food, dehydration, living conditions that are unsafe, unclean, infested or inadequate. The following behaviors support patients' rights. Never abuse a patient physically, verbally, psychologically or sexually. Observe and report. Watch for and report any signs of abuse or neglect to supervisor. Call the patient by the name he or she prefers. Involve patients in planning and making their own choices and preferences about care. Explain procedures to the patient before performing them. Behaviors that support patients' rights, continued. Respect a patient's refusal of care and report to supervisor immediately. Tell supervisor if a patient has questions, concerns or complaints about care. Be truthful when documenting care. Do not talk or gossip about patients. Keep patient information confidential. Knock and ask for permission before entering a patient's room. Behaviors that support patients' rights, continued. Do not open a patient's mail or look through his or her belongings. Do not accept gifts or money from patients. Report any questionable financial practices to supervisor. Respect patient's property and handle personal possessions gently and carefully. Report observations regarding a patient's condition or care. Substance abuse. Substance abuse is the repeated use of legal or illegal substances in a way that is harmful to oneself or others. Many types of substances are abused, including alcohol, tobacco, legal and illegal drugs, etc. Over-the-counter medications, including diet aids and decongestants, can be addictive and harmful. Even household substances, such as paint or glue, are abused, causing injury and death. The harm caused by substance abuse may come in many forms: damage to the abuser's health, legal problems, damage to the abuser's relationships with family. Chemical dependency is more severe and may involve needing greater amounts of the drug and having symptoms even when not using it. In this situation, chemical dependency is a disease. It affects a person physically, mentally and emotionally. It is treatable, but frequently requires diagnosis and care by specialists. A home health aide may be in a position to observe the signs of substance abuse in patients or their family members. The home health aide must report these signs to the coordinator in the agency. Observations can be made without accusing anyone of abuse. The home health aide should simply report what he or she sees, not what he or she thinks the cause may be. Substance abuse. Home health aides must observe and report the following: changes in physical appearance, red eyes, dilated pupils, weight loss, changes in personality, moodiness, strange behavior, disruption of routines, lying, irritability, smell of alcohol, cigarettes or other substances on breath or on clothing, diminished sense of smell, unexplained changes in vital signs, loss of appetite, inability to function normally, need for money, or money missing from the home, confusion, forgetfulness, blackouts or memory loss, alcohol or cigarettes missing from the home, frequent accidents, problems with family,